Rheumatoid arthritis, or RA, is an autoimmune disease characterized by inflammation of the synovium. This inflammation causes chemicals to thicken the thin layer of tissue that lines and lubricates the joint. Over time, the thickened synovium may damage the cartilage and ultimately the bone itself. Those suffering from RA may experience symptoms such as pain, stiffness, swelling, and impaired function of the affected joints. In advanced cases, the condition may lead to configuration and twisting of the affected area. Rheumatoid arthritis can appear at any age and affects both sexes, although it is more prevalent in females. Women are thought to be 3 times more likely to suffer from RA than men. Moreover, RA is not often confined to just one joint. Many individuals find themselves symmetrically affected, such as in both hands or both knees. Juvenile rheumatoid arthritis, or JRA, mirrors the adult version and is the most common form of arthritis found in childhood. Much like its adult counterpart, any joint in the body may be affected in the juvenile form of this disease. What caused your arthritis? Many factors are known to contribute to various types of arthritis. Unfortunately, even with modern medical practices, pinpointing a specific root cause is nearly impossible, which complicates effective treatment. This chapter will cover some widely accepted risk factors and causes known to contribute to all types of arthritis. Additionally, we'll explore some lesser-known possibilities that research indicates may also have a bearing. This is just a small list of some of the risk factors thought to be responsible for and attributed to arthritis. We will also discuss how many prescribed and over-the-counter drugs may play a very damaging part, which we will cover in more detail later. Obesity places unnecessary pressure on supporting joints, especially the hips and knees. It's challenging to determine whether obesity actually causes arthritis, or if having arthritis leads to obesity. Either way, obesity has a detrimental effect on all of us. It is very clear, however, that a reduction in weight will greatly benefit people in all walks of life, especially those suffering from osteoarthritis. As the body becomes older, it may become more susceptible to arthritis. The reason for arthritis being more prevalent in the elderly is due mainly to the bone becoming brittle. With age, an increasingly brittle cartilage has less capacity to repair itself, which may ultimately lead to arthritis. A lesser-known reason for rheumatoid arthritis becoming worse or developing with age may be a buildup of toxins throughout the gastrointestinal tract. It is very common for osteoarthritis to develop after a serious accident, trauma, or even surgery. Osteoarthritis will frequently develop in the joint where the damage occurred. Arthritis, as we know, is not a disease restricted to sex. However, women are far more likely to develop arthritis, especially rheumatoid arthritis. Research has suggested a figure of around 60% of all arthritics to be female. Gout tends to be more prevalent in the male population. Articles linked to gout suggest alcohol may be a contributing factor and may help explain why more men than women suffer with this condition. Studies into the causes of arthritis suggest the association of specific genes which could be linked to certain types of arthritic conditions. It's thought that rheumatoid arthritis, or genes containing the disease, may be passed down through family generations. Having the gene passed to you through family puts you at a higher risk of developing arthritis, known as genetic predisposition. This, however, does not mean you will definitely develop the condition. Smoking cigarettes and passive smoking has damaging effects on many parts of the human body. It's clear to everyone what smoking does to their heart and lungs, not to mention their skin. You may be surprised to learn that studies now indicate a very strong link between smoking and rheumatoid arthritis. The connection is yet to be fully understood, but research has shown that smoking releases excess free radicals and toxins into the bloodstream. Excess free radicals, along with numerous other toxins, are known to attack and affect the immune system, which may cause abnormality in white blood cells. Smoking over a long period may also have a significant effect on bone and the bone's ability to repair itself. There are very few foods which cause obvious allergic reactions. The best known are probably peanuts. Not knowing what foods you may be allergic to is a real problem, a bigger problem than you might imagine. Many people go through life with food intolerances and never show any classical signs of an allergy. For this reason, they may never suspect their favorite food may be the cause of their arthritis. Symptoms of food intolerances, when apparent, are more often than not delayed reactions, so even if you do display symptoms, it can still be difficult to link a reaction with a particular food. Nutritionists specializing in food intolerances and arthritis suggest that the main culprit will be our favorite food or beverage, the foods we crave, the food or drink you can't live without. These foods may have an addictive quality. Candida is normally harmless yeast contained within the gastrointestinal tract. Under normal circumstances, Candida is a sugar-fermenting yeast which, along with other microorganisms, helps break down and digest food. The human body's biochemistry is very fragile and may be easily thrown off balance. Candida can transform itself from part of the body's natural yeast into a pathogenic fungus, a condition known as candidiasis. The transformation of Candida into candidiasis can be caused by the prolonged use of antibiotics, stress, diabetes, acidic pH level, and depleted immune system. Candidiasis growth can affect the normal functioning of the gut. Without treatment, the fungus can penetrate the wall of the gut, causing leaky gut syndrome. Once through the wall, candidiasis can pass through the bloodstream, releasing toxins which can attack any of the body's organs. Candidiasis is also known to decrease the body's nutrient uptake, leading to vitamin and mineral deficiency. Heavy metal poisoning has become a major health problem in recent history, and will inevitably become much worse as more countries become industrialized nations. Metals and industrial byproducts seep into the water and enter the food chain. Heavy metals have a density of over 5 times that of water. The human body is unable to successfully break down the foreign bodies, and is forced to retain them. The accumulation of heavy metals trapped in the body causes toxicity to poison the bloodstream, leading to damaged kidneys, lungs, nervous system, and other organs.